Hi, I'm Dr. Garcia again, and I was recently asked what makes a good candidate for a mini lift. Uh, First of all, we get to the part of the emotional need of the patient, and that really becomes evident when a patient has seen their face repeatedly in the mirror and they know that they want to change something. And it really comes down to looking at the effects of aging in the mid-face. Now, keep in mind the difference between a facelift and a mini lift is all about the regionality of the procedure. For instance, a mini lift generally entails two parts of the face that are being lifted, either the brow or the mid-face, or the mid-face and the neck. Whereas a facelift usually encompasses all three areas of the face that are being treated. Now, having said that, there's three major components to the aging process, and in my book and on our website, we kind of go in those into a little bit deeper discussion. But for sake of brevity, I will discuss mostly the gravitational component, which is the part of the aging process that the mini lift would address. Now, what you're looking at is two different types of descension and gravitational changes to the face. First, in the mid-face, you're seeing a down and in drop of the face that's kind of falling towards the outer parts of the mouth, but stopping at a vertical line from the corners of the mouth downward. And so as that tissue begins to drop down and in, it'll stop, and then it begins to fall down, and it creates the jowls. The term jowl is Latin for broken jawline, because if you look at your profile or the angle or the oblique angle of the face, you'll see that it actually looks like there's a step off and a break in the jawline. And so the treatment is always going opposite to the effects of aging, right? So we are treating this mid-facial descent in an opposite direction, so we're lifting up and out. And so the neck is a little bit of a different change, and what you've seen there is bands in the neck that have developed, and these are a result of a muscle that was once together that pulled apart, and so now you have these two identifiable bands. And so what we're doing is we're suturing those back together and redraping the neck in a little bit of a different vector of lift. And so the mini lift really entails a very similar procedure to the facelift in terms of what we're doing underneath the skin and the musculature and mobilizing and moving fat and muscle into the correct place. But it all has to do with the regionality. So if we're doing more areas of the face, we generally will call it a facelift. If we're doing less, then we start confining our nomenclature and changing it. So there's not much of a difference between the mini lift and, say, the Contoura lift. The Contoura lift just happens to be a procedure that I developed that's a spin-off of the mini lift, but not much of a change. It's just my own proprietary technique. But yeah, that's, in any person who has issues of aging within the jawline, in the neck, or even in the upper third of the face in the brow area becomes a suitable candidate for a mini lift. So log on to our website, see a little bit more before and after pictures, and there's a little bit more detailed explanation of the procedure. I do have some schematic videos that show the lifting techniques and how we do it. And I welcome you, as always, to come in for a consultation and see us should you have any further questions. So I really look forward to seeing you, and thank you so much for checking in. Have a good day.